Welcome to our new presentation. Our selected topic for today is urinary tract infection. In this video, we have discussed about all the risk factors of urinary tract infection. In our previous videos, we have discussed about definition and types of urinary tract infection. Sign and symptoms of urinary tract infection. Main causes of urinary tract infection for women and men, and why female are more prone to UTI than male. The links of all those videos are on the description. You can watch those. Welcome once again to our nursing exercise channel. If this is your first time here, we have a YouTube channel that aims to enrich your knowledge about your health, fitness, medication, nutrition, diet, etc. And if it is your plan to update yourself about these important issues for all of the important tips, advice, discussion and presentation, make sure to subscribe to our channel and click on our notification bell icon. Let's start our presentation. Risk factors of urinary tract infection. People of any age and sex can develop urinary tract infection. However, some people are more at risk than others. The following factors can increase the likelihood of developing a urinary tract infection. 1. Gender anatomical factors. A woman's urethra is shorter than her male counterparts. Women are affected much more often than men because women have short urethras that allow relatively easy passage of bacteria into the bladder. Woman's urethra opening is located close to the anus, so it is easier for her to bring bacteria from the anus into the urethra. 2. Pregnancy. Due to pregnancy-related changes in the urinary tract infections may also be more common during pregnancy, especially from week 6 through week 24. During pregnancy, the drainage system from the kidney to the bladder widens, so urine does not drain as quickly. This makes it easier to get an infection, and sometimes germs can move from the bladder to the kidney, causing a kidney infection. 3. Menopause. Women who have gone through menopause may also have a greater risk of urinary tract infections, possibly due to hormonal changes that might affect the beneficial bacteria responsible for fighting off harmful microorganisms in the urinary tract. 4. Diabetes. The patients with diabetes are more prone to get urinary tract infection due to frequent urination and high blood sugar level. The high sugar level gives favorable growth environment to the pathogens. 5. Alzheimer's disease. In Alzheimer's disease or dementia, it may be harder to maintain personal hygiene, for example, washing regularly, changing clothes. This may increase the risk of developing a urinary tract infection. 6. Spinal cord injury. Neurologic deficits following spinal cord injury 11 result in incomplete bladder emptying and necessitate catheterization for urinary drainage, both of which predispose a patient to urinary tract infection. 7. Kidney stones and enlarged prostate. Kidney stones, enlarged prostate, or any other issue that blocks the normal flow of urine and encourages bacterial growth. 8. Urinary catheter. Anyone with a long-term indwelling urinary catheter is at risk of developing a urinary tract infection. Using a catheter can introduce bacteria into the bladder and cause a urinary tract infection. 9. Sexual activity. Sexual activity is one of the most common lifestyle risk factors for urinary tract infections, particularly for women. It's thought that sexual intercourse may transport bacteria from the genitals and anus into the urethra and, in turn, lead to infection. For men, Unprotected sexual activity involving women with a vaginal infection may increase risk of urinary tract infections. 10. Birth control. Use of certain types of birth control, such as diaphragms or spermicide, may also raise urinary tract infection risk in women. 11. Personal hygiene. Several personal hygiene habits are also considered risk factors for urinary tract infections. These habits include the followings. 1. Use of douches and feminine hygiene sprays or powders. 2. Wiping from back to front after urinating or having a bowel movement, especially for women. 3. Retaining urine for an abnormally prolonged period. 4. Extended periods of immobility, such as during recovery from an injury or illness. 12. Vesicoureteral reflux. Vesicoureteral reflux is the abnormal flow of urine from your bladder back up the tubes, ureters, that connect your kidneys to your bladder. Normally, urine flows from your kidneys through the ureters down to your bladder. It's not supposed to flow back up. It is usually diagnosed in infants and children. The disorder increases the risk of urinary tract infections, which, if left untreated, can lead to kidney damage. 13. Bowel incontinent. Bowel incontinent patients develop urinary tract infections almost 3 times as frequently as their bowel continent counterparts. If you have any query, please comment in the comment box, and if you enjoy watching our videos, please subscribe our channel to receive notifications every time we upload a new video. Hit the bell icon twice. Thanks for watching.